Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to play detective. We're diving headfirst into a real medical mystery, one that starts with some pretty confusing symptoms. But stick with me because by the end of this, we're going to crack the case by figuring out what happens when the body's chain of command goes haywire.
So our story kicks off with these exact words from a 44-year-old man. He just knows something's not right. This isn't just a random ache. This is getting worse, and it's starting to really mess with his day-to-day life. This right here, this is our very first clue.
From the get-go, this patient's weakness is a total puzzle. You know, at first glance, all the clues seem to point in one direction. But as we're about to find out, they're actually hiding a much, much bigger problem.
Okay, so here's the rundown from his case file. He figured, hey, it's probably just my old shoulder injury acting up again. But that doesn't explain why he's suddenly having trouble walking, right? And it's getting so bad that simple things we take for granted, like getting dressed, are a real struggle. And the weirdest part? No new injury, no headaches, none of the usual suspects are anywhere to be found. The story just isn't adding up.
So when the clues on the surface don't make any sense, what do? Well, you've got to dig deeper. The doctors knew they needed to get a better look under the hood. And what they found? Well, it completely flipped this case on its head. And here it is, the smoking gun. An MRI of his brain shows a lesion, that's just a fancy word for an area of damage, and it's located right in the middle of this super important pathway called the corticospinal tract. This is it. We found the crime scene. The problem isn't in his shoulder at all. It's deep inside his central nervous system. Now, to really understand what this lesion means, we first need to get a handle on how our body's motor system actually works. The best way to think about it is like a big corporation with a really strict chain of command, sending messages from the head office all the way down to the frontline workers.
And that pathway we just found on the MRI, the corticospinal tract, that's the main communication superhighway in your body. Seriously, every single time you decide to move, to walk, to wave, to pick up your phone, the signal for that action is zipping down this highway.
And this lays it out perfectly. The command starts at the very top, in the motor cortex. Think of it as the CEO's office in the brain. From there, the signal travels down through the brainstem, which is kind of like central command, and it finally reaches the local office, down in the spinal cord where the message gets handed off.
Okay, now let's meet the key players in this whole operation. First, you've got the upper motor neuron, or UMN. This is the manager. It lives upstairs in the brain and spinal cord, and its job is to give the orders. Then you've got the lower motor neuron, or LMN. This is the worker. It gets the order from the manager and then connects directly to the muscle to get the job done. It's that simple. Manager gives the order, worker carries it out.
So, back to our patient. He has a lesion, some damage, right on that main highway where the managers live and send their signals from. And what that means is that the whole chain of command is broken. And that, as you can imagine, leads to some pretty dramatic consequences.
So let's just think about this for a second. Using our analogy, what happens at the factory when the manager suddenly goes offline? When there's no one there to give clear instructions or to just keep an eye on things?
In the medical world, the term is disinhibition. And here's the absolutely crucial part to understand. The manager's job isn't just to shout go, it's also to provide a constant, whoa, calm down signal. It's like having a foot on the brake. So when that manager goes offline, the brakes are gone, and the workers, they lose all control. To put it as simply as possible, the workers go wild. With no management, no oversight, no one telling them to chill out, the lower motor neurons just start firing like crazy. There is absolutely nothing keeping them in check. And this idea is the key to understanding everything that's happening to our patient. So what does this worker rebellion actually look like in a person? Well, you get a huge increase in reflex activity. That little tap on the knee that causes a small kick, now it's a giant exaggerated kick. You also get really high muscle tone, something called spasticity, where the muscles get super stiff and tight. The whole system is basically short-circuiting. Okay, now that we've got the science down, we can go back and finally solve our case. We know our patient has an upper motor neuron lesion, a manager problem. So, given that, what other sign are we most likely to find when we examine him?
The prime suspect, and the correct answer, is hyperactive deep tendon reflexes. This is the absolute classic textbook sign. With the manager offline, the workers, those reflex circuits in the spinal cord are completely disinhibited. They totally overreact to everything. It fits the UMN profile perfectly.
Now, just to be thorough, let's rule out the imposters here. What about the other possibilities? Muscle wasting or atrophy? Nope. That happens when the worker itself is damaged and the muscle loses its connection. Same goes for fasciculations. Those are the little twitches you can sometimes see. And low muscle tone or hypotonia? Again, that's a worker problem. All of these are signs of a lower motor neuron lesion, and we know our guy has a manager problem.
And there we have it. By taking a minute to understand the body's chain of command, we've solved the puzzle. Our patient's weakness, his clumsiness, his trouble walking, it wasn't some old injury. It was all the direct result of a lesion messing with his upper motor neurons.
And here it is, the final cheat sheet. This is the big takeaway. On one side, you've got your manager is offline signs. That's spastic type of weakness, overactive reflexes, high muscle tone. On the other side, you've got the worker is offline signs. Muscle wasting, weak or absent reflexes, those little twitches, and low, floppy muscle tone. You see how they're almost perfect opposites? Knowing this difference is everything when it comes to diagnosis.
So if you remember just one thing from all of this, let it be this simple rule right here. If you know the problem is in the brain or the spinal cord, where the managers live, just think to yourself, the calming signals are gone. It's a total loss of inhibition. And the result? The reflexes go wild. It's a super simple concept that unlocks a really complex problem.